Still Standing is sponsored by Fairfax Radiology.
We always hear about the importance of mammograms to prevent complications from breast cancer. But this message is personal for Dr. Sharma of Fairfax Radiology, who found out that she had breast cancer from a routine screening, and she didn't have any symptoms. Dr. Sharma, welcome to Great Day, Washington. Thank you for being here.
Thank you for having me.
Well, October is Breast Cancer Awareness Month, so it's a very busy month, and we have a lot to talk about. But first, tell me about your journey, because this is personal to you as well. Tell us about that.
Absolutely. I am a survivor, and it is very personal. I was diagnosed, but I'm an excellent story. My disease was found on a screening mammogram. I had no symptoms, no signs, nothing. My radiologist picked up some subtle changes. I went through several tests, several biopsies, some treatment, and here I am.
Wow, here you are. So I'm sure coming from that perspective, it's also unique for you to be treating people.
It gives me a lot of compassion for what people are going through.
Right.
I've been there. I've had all the biopsies and had all the waiting and the anxiety. And it's nice to know that there are other people out there that have been through the same thing. And sometimes it's nice to remember that, you know, your physician is a patient too sometimes.
Absolutely. Now let's talk about mammograms. If someone gets a mammogram and then they get called back for some additional mammogram or other tests, is that something they should be concerned about? Does that mean they have breast cancer?
There's a lot of anxiety with callbacks, and rightly so. However, most of them are just for additional tissue. We want to see more of the breast tissue. We want to see things at a different angle. There may be something as benign as a cyst or something on the skin that we're looking for. Most callbacks are absolutely nothing to worry about.
Okay.
Very few, we go further.
Okay, that's great to hear, because people are listening and sometimes they get that call back and it just creates so much anxiety. Now, most women also get a mammogram at the age of 40, is that right? But some have to go a little bit sooner. Is that because of genetic factors? Tell us about that. Oh, okay.
So we recommend that most women, as you said, start screening mammography at age 40 and go every year thereafter. For certain patients who have genetic predisposition, which just means that breast cancer runs in their families, that can be in a first-degree relative, such as a mother or a daughter, we recommend that those girls start earlier. We can also do genetic testing to look for markers that show that a patient is more prone to developing breast cancer. Certain genes, such as BRCA, can increase your likelihood of developing breast disease up to 90% in a patient's lifetime.
Okay.
So we want to be extra careful with those patients, and you know.
Absolutely. Does it matter where you're getting a mammogram? There's a lot of options.
You want to go to a place where your radiologist is only reading breast imaging. I think that's incredibly important, because we are more in tune with subtle changes on a mammogram. Our machines are higher technology. Our technicians are only looking for certain diseases. And places like Fairfax Radiology, we're all specially trained just in reading breast. And it makes a really big difference.
I can see that, and I can see you're very passionate about that too. That's really great advice. As we come into Breast Cancer Awareness Month, what other advice do you have as we kind of finish this conversation here?
Every woman should do a monthly self-breast exam. Okay. They are the first line of defense for all of us. Beyond that, you should be doing your yearly screening examination. It is very hard to, especially for ladies who are taking care of their families, their kids, their parents. It is hard to break away and take care of yourself, but it is something that is so important.
So important.
We can't state it enough.
Yeah.
Do your yearly mammogram. If additional imaging is needed, we'll take care of you.
Okay. Dr. Sharma, thank you so much for being here.
Thank you.
Yeah.
For more information and to schedule a mammogram, visit fairfaxradiology.com.